How close are we to a COVID endemic? Well, doctors say we are closer, but not there just yet. Doctors say to ride out this current wave of disease, people need testing, masking, and to stay home if they're sick. According to state health officials, 68 out of North Carolina's 100 counties are in high-risk transmission. Queen City News reporter Will Lewis is live from West Charlotte. And Will, doctors are really urging people to not get tested for COVID at the emergency room. Why is that?
Well, that's right, Morgan. They say just to use the at-home test, go to your primary care physician or here at an urgent care location. They say if you go to the emergency room, you potentially could spread that virus to people who are at risk. Now, the COVID infections are on the rise, as you just said, but doctors say the symptoms are milder with this variant. There's a new COVID variant spreading across North Carolina.
We anticipated this would be the case, and we're not surprised by it.
People coming back from traveling to visit family for the holidays and not taking as many precautions because over the last 2 years,
everyone in my household has had it, and we're all fully vaccinated.
Unless everybody gets vaccinated, and even if they are vaccinated, they're still going to get it. But yes, I feel like it will always be around.
Novant Health professionals say the XBB 1.5 variant is becoming the dominant COVID variant, representing 28% of cases in the state. The symptoms are less severe than other variants, and that makes it difficult to diagnose patients.
There will be times when people say, oh, it's my allergies, or I just have a cold and it's COVID, and they don't realize it because it's so mild. And it's hard to totally avoid those situations.
Currently, 260 people have been diagnosed with COVID in the Novant Health system. That's more than 100 people from December, but less than the 760 people a year ago. Doctors say as more variants of Omicron develop, they are not as strong, but highly contagious.
We select out for viruses that spread widely, make a lot of people sick, but don't necessarily give them severe disease or death. And so that's just the natural progression of how these viruses work, moving toward hopefully what's an endemic phase where, like, we have influenza.
And doctors say that they do like this trend they are seeing, and if it keeps up, we could be at endemic levels soon. But they do say all it takes is one mutation with a variant to put us back in that healing process. We're live in West Charlotte. Will Lewis, Queen City News.
Will, thank you very much.